Like infertility is hard. Being a working parent is hard. Being a startup CEO like Amy and I are, it's all hard. Okay. Everybody, wherever you're at, there's just so many things that have been hard, and hormones shouldn't be one of them. Understanding your hormones shouldn't be one of them.
Agreed. Agreed. That's like I feel like it's our hormones and our fertility health is just such a black box until you
Hmm.
go through your own fertility journey, and then
Right.
all of a sudden we all become these experts in
Right.
what our menstrual cycle actually means, why we have a period. It's
Hmm.
you just have to live
Yeah.
it.
It's even starting from the very top of like, what's a normal cycle, you know,
Yeah,
and how wrong it is to consider that a 28-day cycle is not the only version of normal.
exactly. So it's funny that you mentioned that because I was on a call with a clinician and they were challenging me on the fact because in our platform we highlight like what a normal cycle is just
Uh-huh.
to show that no one fits that model.
Right.
And they were challenging me on that normal curve that I set that we drew out, and they're like,
Mm-hmm.
that's not accurate. I'm like, I know it's not accurate.
Mm.
Look at the real data, it's not
But it's
accurate.
the exactly.
But they were challenging me on the fact that like we had to shift it by 7 days or 2 days. And I'm like, this is just a model and it's not even accurate. But
Wow, isn't that funny? Oh my gosh. Well, I mean, this is that your area is not the only area that we hear pushback,
right,
from doctors, right? I mean, they get into their myopic view, and sometimes they need to be brought out of that myopic view.
exactly. And what better way to do it than like objective data?
Exactly. That's what you and I really geek out about is we love data. So we already have some questions coming in. Stephanie's asking, can doctors tell from a progesterone exam if you're pregnant? She had one done after ovulation. Her OB got her hopes up really high.
I don't think you can do just progesterone. I mean, it depends on where you are in your cycle.
Hmm.
Yes, if you are pregnant and you successfully conceive, the progesterone should remain elevated. And yeah, it should be at a certain level, but it's not the only variable that matters, right? You need to
Hmm.
see what that beta HCG is. You need to make sure
Right.
that all the other hormones are aligned as well, because just elevated progesterone isn't really enough, but it can be a good indicator.
Okay, got it. Because now, if they just measured her progesterone and didn't see it over time stay elevated, then it wouldn't really be a pregnancy indicator, right? I mean, you'd have to see that it stays elevated.
Yeah, and like I mean, the reasoning for that is what if her progesterone is typically on the higher end,
Right. And she doesn't know.
right?
Right. Which is the value of your kit, of the OOVA
Exactly,
kit, is that you can measure it over time. So you truly learn about your own levels rather than your own levels as it relates to, whatever lab standards say that they should be.
exactly. And then it's also not looking at it as a single snapshot, right?
Right.
So what Stephanie's talking about here is you have one single progesterone measurement, and now it
Right.
depends what cycle day you're on, where like
Sure.
what part of your phase are you at? Are you close to your period? Are you far from it? Like that all
Right.
matters.
So okay, so then I guess the next question is, if she was at her OBGYN, why wouldn't they have drawn a beta HCG level?
My guess is that she probably got a progesterone done 7 days post ovulation, and that's typical to do. But
Hmm.
again, I'm going to challenge it
It
with it
might be
depends on
too
how long your
early
cycle
to
is.
show up on a P stick, right? And it might be too early to even show
Yeah,
up to even have a viable beta HCG level drawn, because if it's only 7 days, we usually do the 2 week wait, right?
yeah,
In our
exactly,
field is we usually wait 2 weeks so that the HCG level at least is detectable, because it could be
exactly.
very early pregnancy indicator. So yeah, so Stephanie, we're not saying that she's wrong per se, but that you'd have to look at the progesterone staying elevated, which you kind of mentioned it's not clinically validated for using the OOVA kit for that reason, but you have mentioned that some of your users did have an early pregnancy indicator because their progesterone did stay elevated.
Well, but we have the second variable too, the beta HCG, right? So what our test
Hmm.
measures is both luteinizing hormone and progesterone, and it turns out that luteinizing hormone and beta HCG, the pregnancy hormone, are very similar in shape. So
Oh.
the antibodies that we use for detecting LH are actually detecting the beta HCG in your urine. So what we say is if you've had a
Oh.
successful ovulation and if you had intercourse on the right days, and you see both LH and progesterone staying elevated post ovulation,
Uh-huh.
that's a sign, an indicator to go get a pregnancy test, because
Oh.
you're not seeing the LH, you're actually seeing beta HCG.
Oh my gosh, that's so fascinating. I had no idea. Okay,
Yeah,
speaking of the kit, and we've got some other folks coming on that I want to wave to and say hi. I love the wave feature.
I
It's a
know.
lot to keep up with when I'm doing these to wave, but everybody, I really am waving because I really am happy to see you. So just know that this is an authentic wave. All right, perfect. Okay, so Preet. Oh, and I saw Preet this morning, I think, or was it yesterday, Preet? She asked some really great questions. Do supplements make hormones balance? If so, which are best to take? I don't know that that's really a question for you. It's more maybe for Dr. Raquel, our
Yeah,
naturopath.
I think so. Like, to tell you which which supplements to take, I'm definitely not the best person, but we have seen in the UVA data, or our UVA users, that when they are using supplements, it does impact their hormone levels.
Ooh, okay.
Yeah.
See, I love data. Okay, so that's really important. So some of the supplements that Dr. Raquel will advocate for, and so will Dr. Chen, and as will, I'm unboxing right now, you guys, my UVA supplies. They will recommend Fertility has a really great inositol product. So go on to Fertility with an X on the end. Their website, they have a great product for hormone balancing that's an inositol product. And Dr. Chen talks a lot about how much she loves the inositol products. And then Dr. Raquel advocates that if you are somebody that's insulin resistant or gluten sensitive, or not gluten sensitive, sorry, sugar glucose sensitive, what she advocates for is also you know what I want to keep saying is Clomid. And that's wrong.
That's really wrong.
That is so wrong. Chromium. There's too many C words out in the market right now. Chromium and Clomid and COVID, and try to say Clomid and COVID in the same sentence and it starts coming out Clovid. Okay. So those are the two that come up on these live episodes the most frequently in terms of hormone balance, and then improving insulin is Chromium, and that's over the counter, and the inositol products. So that's super fascinating data though that you're seeing. Now, do your users report in the app which supplements they're on so that you can do a write-up about this?
We're going to add that feature in. The problem is that there's so many variables. Like, you need to either have it, like, now I'm nerding out, but you need to have either controlled vocabulary for it, or to have that list is astronomical.
Yeah. Oh my gosh, it's so big. Yeah.
Yeah. So you want to avoid people having to type it in. Right.
Okay. Yeah, of course. Right.
But what's really great is that with the progesterone measurements that we do, we've had a lot of clinicians actually start their patients on progesterone suppositories or supplements if their progesterone starts to drop at post ovulation.
Oh, okay.
Yeah. So that's been really useful on many fronts.
Yeah, that sounds really useful. Oh my gosh, that's so great. Okay. A couple other questions coming in, and then I'm going to show my kit, show my box, and I'm going to start. Okay. J Pom was asking, is there a correlation between low estrogen and heavy periods, like clotting heavy? She's been tracking her hormones since her last pregnancy loss. Very sorry to hear about the loss. And she's had very heavy periods, but low estradiol levels.
I'm not sure. I think there's still a lot of variables to account for there. But yeah, there has been reports that show that estrogen is going to directly impact your bleed, especially early on. So that's an interesting question. I'd have to look into the literature to see exactly what
right.
saying.
And since she did have a loss, I know Dr. Chen would advocate that you get a water sonogram done just to make sure that there's no tissue that's left behind, and that could be causing heavy periods as well. So that is something. And I think Dr. Perlow, if you're on this episode, I think you are, maybe weigh in on that as well, if there's anything else that we should point her in the right direction for. And is it true that HCG levels should double after 24 hours for normal pregnancy?
If you look at the range of what your beta HCG should be in like the first 3 weeks to the next 4 weeks,
so
it's
huge.
insane. That range is so big.
Yeah, it's so wide.
Yeah, I wouldn't say, if it's not doubling, I wouldn't be concerned in 24 hours. You really want to see how that beta HCG is increasing over like the week and every subsequent week. I wouldn't put so much emphasis on day to day.
Right. And I don't remember it being every 24 hours. I remember it doubling every 48 hours.
Right.
We don't check every single day. And the thing that brought me comfort was just seeing my pregnancy line, taking the pregnancy test at the same time every day. If it's darkening, then you know it's also increasing, just to like calm the nerves. Because I think that what we get tripped up with is that specificity of the number, and then we get anxiety that we might miscarry, which doesn't help matters.
Right.
You know, we have to stay calm. It's not that the anxiety causes a miscarriage, but it definitely you know, plays with your ability to just kind of enjoy being pregnant and
100%.
being, you know, self-loving, doing a lot of self-care.
Oh my gosh, I could have sworn that there was a higher chance of me having stomach cancer than being pregnant. So when I got, because it wasn't happening for me.
Right.
And so when I got my first pregnancy test, and I saw that super faint line, I was like,
Right.
yeah, right. There's something wrong with the test. And I threw it away. And
no
then,
way.
Yeah. And then 2 days later, like the second day, my test ended up being a dud. And the third day I had a super dark line.
Wow.
I'm like, oh, okay.
So this really is happening. Oh my gosh. And of course, I just was terrified the entire time I was pregnant with Dante, finally, that I had twins. And even with being open on the table for a C-section, I still was like, are you sure there's not another one hiding? Because I, you know, being a single mom and doing a frozen embryo transfer, and I just thought I can't handle this on my own if there's twins. So we all have our anxieties, right? We all do. So one of our other audience members is no longer naturally ovulating. She has low AMH. We'll be trying to use letrozole with a trigger shot next month. She's only 29. Would OOVA be helpful for her?
100%. At least understanding what's going on with your hormones, because you're saying that you're naturally not ovulating. How's that being detected? Is that through the ovulation predictor kits that are all over the counter, or is that medically that you're no longer ovulating? If it's the former, where you're using the over the counter test, you may be falling into the same bucket that I did, where all those tests told me I wasn't ovulating, but my LH surge was just significantly lower than what the thresholds were designed for.
Oh, so you never really knew when your window was, because LH alone didn't work for you, just like it doesn't work for those who have PCOS or other people like you who have low levels of LH.
Yep. So it wasn't until I started using OOVA where I saw that my LH surge was just significantly lower than what that threshold was. But I was ovulating.
Interesting. Okay, so this is what the current kit looks like. Amy's been really excited because I wish that we could do the mirror. I don't know if it's possible to do the mirror thing, but Instagram needs to figure that out. So it's a beautiful box. I really love the box. It's very subtle. Take note, keep out of reach of children. Okay. And so then I have my little packet here, and it has this handy little holder. So I'm going to balance my handle right there. So I'm going to open this up. I love your logo. I don't know if I ever told you that before. I really love your icon.
Thank you.
So I'm opening it up. And so here's my pee stick. I'm still going to pee on this. Goes right in here. You can't get it wrong. It's very obvious. Does it click? Is it supposed to click?
You'll feel like some feedback.
Okay. Yeah, there we go. All right. And then that's all we're going to do is we're just going to pee on this. Now, each one has a QR code. So what's that for?
Sure. So there's several functions for that. One, it actually helps us find that window, because what you'll see in that window, you'll see 1, 2, or 3 lines, depending on what your hormone concentrations are. So first line is the control line, letting you know that the test worked. The next line is your progesterone line. That will actually get fainter, so lighter, the higher the concentration of progesterone. And then the last line, which is closest to the QR code, is your luteinizing hormone line. That will get darker the more hormone present.
That's amazing that is all right in this little tiny innovation. That's it. So like you have the 2 lines are actually registering different hormone levels for 2 different hormones.
Yeah. So we've multiplexed
on this little tiny thing. And that's called multiplexing.
Yeah, it's called multiplexing.
Well, this is why we say like she put the lab is in your home now because of this. That is so cool. That it's an actual quantitative measure, right? So it is like
it is a quantitative measure, but obviously the test strip's not going to tell you that. So
the test strip doesn't say like 27.
We're not there yet.
No,
We'll
it's too
get there
tiny.
eventually.
The window's too tiny.
But what happens is you actually scan that with your phone. So you'll align that
Okay.
QR code in the app. So what happens is the app will instruct you to provide a urine sample. You wait 10 minutes, and then when the timer goes off in the app, it opens up your camera on your phone and you scan
Cool.
that. So you
Okay.
literally just align the QR code in the boundary box. We scan that window and we do all the
Awesome.
interpretation directly in the app. So you get your results within seconds. And that's
That's
where you'll
very
see your
cool.
27.
And see that no drippy. See, you
No
just,
dripping.
when you do your urine sample and that, and you can, do you just catch it midstream?
You could do midstream or as a dip test,
Okay.
however you prefer. So we work in both
Yeah,
ways.
that's
That,
perfect. Very easy.
yeah. So that sample pad is actually used in airline craft carriers. So
For
it's
what?
like just for insulation. So it's super absorbent. You're not going to have any dripping.
Oh,
Because that was my big
oh,
thing. I'm like, I don't want
that
urine
is,
everywhere.
that is really interesting little factoid. So
Yeah.
this, I'm going to touch this one because I won't use this one since it's out now. But so this particular part, did you guys catch that? This is on airlines as insulation so that you're not freezing on an airplane. That's amazing factoid. All these things that you learned about. Okay, I just dropped
Yeah.
mine. That's okay. That's not the one that I'm going to be doing. I'm not peeing on a stick on live TV. Just
I was like,
letting
how
everybody
far are we
know.
going with this?
I have done a lot on these episodes. I've pricked my finger for lab tests. I've spit in a tube, but I'm not going to urinate on a
You
stick.
could
That
have
is
had a urine
private.
cup right next to you.
I was
So
thinking about doing that. I was actually thinking about that for this show.
I'm glad you
All
did.
right. I'm sure everybody else is too. So we have a 43-year-old trying to conceive, dealing, she does have 2 daughters, so dealing with age and some secondary infertility, any medications that can help her. So probably not not an Amy question about medications. So on Mondays, we have, we alternate between 2 IVF doctors who are off this week, but Dr. Chen can answer that question. You know, the thing at 43, though, that both Amy and I can advocate for is that you rapidly get in to see a fertility specialist because age isn't on your side. Time isn't on your side.
Yeah.
So the harsh reality, I'm 44, I'm just a year older than you. You know, the harsh reality with age is that no matter how healthy we are, our ovaries don't care.
Yeah.
There's just nothing that we can do about the age-related decline of the number of eggs that you have left and the number of quality eggs that you have left. So as we age and that the number of eggs that could result in a pregnancy go down, the risk of chromosomal abnormalities goes up. And you could be the healthiest human on the planet. That is just biology.
Yep.
Can't do anything about it. So I would just say that if you know, are ready to have another child at 43, I would rapidly get in, but starting with an OOVA kit to at least know what's going on hormonally, to confirm that you are still ovulating, that you're not heading into menopause early. You know, these are important things. If you wanted to start somewhere, I would say you could start there. I believe we give people 10% off if they put in Fertility Answers. I think it's 10% off. So if you go to OOVA.life and then purchase a kit, and you'll get 10% off. And she said she hardly sees ovulation, hasn't seen it or experienced ovulation. So I think that if you want a starting point, you know, you could start there with an OOVA kit, but I would beeline into a clinic. If you're open to IVF, if you're open to assisted reproduction, now is the time to try to do a couple back-to-back egg retrievals so that you have a cohort of potential embryos to work with.
Exactly. And I think you'd want to see if that progesterone rise is actually happening post an LH
Exactly.
surge. See how your progesterone is behaving over time.
Right, right. So Gladys is asking, when do you recommend getting a sonohystogram? So this is not my recommendation. So what Dr. Chen would say is, and she's an IVF specialist, is you can do a water sonogram just to make sure that your uterine cavity looks good. It's free of abnormalities. That's common before frozen embryo transfer. You do an HSG when you have to see if your tubes are open And that's where they have to use a balloon to inflate your uterus, and they shoot dye into your tubes so that they can see if the dye goes passes through the tubes and into your uterus. So those are two important tests that you need to have the tubes open if you're trying to have babies without using IVF. And that's really important consideration. If you end up seeing fluid on the ovaries, then IVF is still warranted because, or sorry, fluid at the on the fallopian tubes or at the end of the fallopian tubes, then IVF is still warranted, but they like to remove the tubes so that that fluid does not go back into your uterine cavity, which will impact implantation and miscarriage rates. So these are difficult things, we know. If you need to reach out to us to have a private conversation, please do. Starting next week, we will have a specialist available in our app where you can have a private Q&A with a retired IVF doctor. So his name is Dr. Perlow. He isn't going to sell you IVF, but he is going to break down kind of the steps for you of like the path that you would take so that you can decide whether or not you want to go in for those types of diagnostics. What we do recommend is that if you're going to get an HSG, you get an HSG at a fertility specialist clinic and not at a radiologist's office. The reason is that some OBGYNs do perform them, and by all means, go to your OBGYN and fingers crossed insurance covers it. The reason we say don't go to radiologists, that radiologists do a lot of procedures all day long. They do a lot of different types of scans, and reproductive scanning is not their specialty. And so what ends up happening that we've seen is we end up having people who are given kind of half of the information, or maybe given the information in a way that makes it seem like there's a problem when there's not. And it's just not their specialty. So we say bypass any confusion by going straight to a fertility specialist to get those HSGs done. Water sonograms are super easy. They can happen in any office as long as somebody has scanning equipment. Okay, so we have another audience member who has an LH surge each month, but found that she's not releasing an egg. How did you know that you're not releasing an egg? How would she know that if she's not using, if she's not using your kit?
I have no idea how you're telling that. She has to be monitoring her progesterone in some way, because there's no other way to, that's the clear indication that you have ovulated, right? Because you'll see the progesterone rise happen. I mean, I'm not sure how she's tracking that without some progesterone test.
Yeah, without knowing. And here's the thing, what we know. Oh, good. Watching from Barbados. Hi, Shara. I love it when you guys tell us where you are. Oh, and great question. Are doctors accepting the results from OOVA?
Yeah, it's actually been pretty overwhelming how quickly it's gotten adopted. So we are now adopted by over 67 practices across the country.
Amazing.
That's almost, I think it's actually over 100 clinicians that are using our product. So just what this means is we actually have a clinician dashboard where if you're working with a provider, you enter their ID in your app, and your doctor is actually able to view your hormone levels and all the data that's relevant for you immediately. So it's all in real time. You don't have to think about, what does my doctor care about? What do they need to know? We take care of all of that for you.
That's amazing.
Yeah.
Oh, that's so exciting, because it just saves time too.
Yeah.
Right. So you don't have to, and I think to her point too, of she sees an LH rise, we see that with lots of people. They see LH rise and they're still unsure of the ovulation part. All they know is that they're supposed to ovulate. And that's what we love so much about your kit, is that they know definitively if it's happening or not. And it's really incredible information, because you tell people, so if I go and register in the app, I should have a second phone so I could do this live. I need to have that second phone so I can go through the steps. You actually tell us when to start tracking, don't you?
Yeah, so we take all the guesswork out of the entire experience. So yes, we do tell you when to start scanning. So it's a completely personalized experience. We also, the whole experience is personalized, like I said. So we capture what your baseline levels are. We detect fluctuations in your hormones by comparing to that. It's all we really want to take the guesswork out of the entire experience.
That's great.
Yeah.
Adiz is following up with what she was saying, that she did have a miscarriage around February. Don't know what the cause would be. You know, that's the thing, is that most miscarriages are caused by chromosomal abnormality. And if it was an early pregnancy loss, like a chemical pregnancy, there's usually not any tissue to test. If it's a clinical miscarriage, you know, meaning it's at the stage that they would have been able to detect a heartbeat and beyond, then sometimes if you have the tissue, then you could genetically test the tissue to see if you can find a cause. Unfortunately, it's very, very common. I've had 5 pregnancy losses myself, and it is sometimes, you know, especially when they're pretty early, we don't know. You know, we often really don't know. I wish that we would do some research around chemical loss. I mean, you know, when we're in this community, we all are so dialed in. We know when we're pregnant, we know when we're losing. And you know, there's a lot of people who have chemical losses that never even knew that they were pregnant because they happen so early.
Yeah. It's amazing how little research there is on things that, like, I mean, this topic is actually
Yeah.
so common, and yet there's so little research on it.
Exactly.
Very little
Yeah.
attention is given to this as well.
It's really true. So much that we need to tackle. Jessica's, she had a tubal reversal, and it was successful. She did get pregnant, but she had a miscarriage.
Oh, no.
So we're so sorry, Jessica, to hear that. And, you know, I feel grateful that, that you didn't have an ectopic, because even with tubal reversals, there is a higher rate of ectopics. And so that's something we always caution people when they do attempt to do a tubal reversal, that IVF can be safer. With a lower risk of ectopic after. But sort of again, Jessica, if, you know, if that was your first miscarriage, then hopefully it is a positive sign that you are able to conceive, and that those eggs are traveling through your fallopian tubes, and that is that your reversal worked. And, you know, don't lose hope. It is, but I certainly, Dr. Chen would say, you know, consider doing a water sonogram and making sure that there's nothing left behind so that you can try again. And if you end up with 2 or more miscarriages, then we would recommend that you get in to see a fertility specialist and get a full recurrent pregnancy loss workup. But many of us, you know, many of us have been through the same. We also like to make sure that you're getting the emotional support that you need, and that you have kind of space, time, and a toolkit with which to deal with the grieving process. This is such an important part of it. And I'm relieved that you came on and even told us, you know, but this is something that, whether it's through a reproductive therapist or through our partner Organic Conceptions, they have a wonderful toolkit that's self-teaching. It's a self-paced course that you can have access to as well. These are tools that exist out there to really just support you and nurture you in, you know, the grieving process, so that you can try again. All right. And that goes for everybody who's dealt with this, which is so many of us. What would cause, this is a great question, which might be PCOS related. Okay. Amy, I love your question. What would cause multiple LH surges in one cycle?
So this is actually pretty common, and it's called biphasic. Like, you have a biphasic chart. So think about what LH actually is and how it's released. It's released from your pituitary gland, and it's a pulsatile hormone, right? So it comes down in bursts, right? So what's happening is you're waiting for that LH concentration in your body to hit a certain level to have the egg actually be pushed out of the ovary and into the uterus, right? So what can happen is you may have an LH surge, so you're hitting whatever threshold those tests are telling you, but it's not enough for your body to push the egg out. So it's going to keep on releasing LH. So you'll see the levels go up and down until it gets to the level where the egg is actually pushed out. And so we see this in the OOVA data.
Fascinating. And this is so much the issue with people with PCOS, because they have that happen a lot. They have LH surges all, and so she said she's having one around cycle day 20, but then not ovulating until cycle day 30-ish.
Yeah, that's not uncommon, and we're seeing it so much with OOVA. And the great thing is, because we have the progesterone measurement, we actually confirmed that ovulation didn't happen until the second LH surge. And
Okay.
so,
Amazing.
yeah,
Wow. So, I mean, and who would assume that they're ovulating at cycle day 30,
right. It's
right?
it's
So,
much more common than we think.
wow, and nobody talks about that. Oh my gosh, this is great. And here's the reality is that if you won't know this information, because who of us has time to go into a lab every single day to figure this out?
Right.
Right? I mean, we don't. Someone else is asking, can acne on your cheeks be a sign of hormone imbalance?
Yeah, it can, but it can also be a sign of a lot of things. Like think about why acne is happening is because your oral balance is off. Everything is dictated by our hormones, the quality of our hair, the quality of our
Mm,
skin. It's all dictated by hormones. So one thing that we're actually tracking in OOVA's platform is capturing all of this information. So you can track what your skin condition is each day, what your hair looks like, your sleep quality, stress levels, all of that. And then we actually
mm,
tie that back to your objective hormone measurements. So we can start to predict like when you're going to have acne outbursts because of
amazing.
the way your hormones are behaving. So
Wow, that's amazing.
there's a lot that's coming.
Oh my gosh, I love that. So I got really into these little acne patches you put on. Now I had a pimple right here. In case y'all can't see it, it's right there.
Can't see it.
And these are amazing. This innovation is amazing. And you just put it on overnight and it like sucks all the oil out. No
Oh, wow.
scarring by trying to get it out or anything. I love them. My son thinks they're disgusting, but they work so well and they are cheap on Amazon. Put
You
in
need
acne
to
patches on Amazon. I'm telling you, it's fantastic.
next purchase for sure.
I know it's amazing. Oh my gosh. Great. So do you guys, any other questions? I'm going to ask Amy a couple of things myself, but if you have other hormone related questions, you know, it's some of the information we've already learned for those who are just joining right now. Hi, Caitlin, is very common to have multiple LH surges throughout the month because your pituitary gland is trying to get you to release enough LH that will push the egg out. And
Yeah.
so that communication pathway is really important. And people with PCOS often have that happen multiple times per month. Was that happening to you too, Amy, when you were like a
No,
low LH? It was
it
just one
wasn't.
time and it
It
was
seems that
low.
that's what I've
Yeah.
seen with my OOVA data. I don't typically have biphasic charts. So
Yeah.
it's just my LH surge is very low.
Got it. Okay.
Yeah.
Very fascinating. Oh my gosh, I can't wait to get started with mine. And I won't necessarily start tomorrow, right? Is that kind of the personalized approach is I'll put in
Right.
my information and then you'll tell me when to start. And then
Exactly.
how many kits are in here? How many chances
There's
do I get?
there's how many chances do you get? You get 15 cartridges. So you're
Okay,
getting 30 hormone measurements. And we try
great.
to time out when to start using the test so we can capture your baseline level. So before your LH surge, the LH surge, and then post surge.
Okay. All right, got it. So 15, which is all you really need in a month. And you recommend that people do a couple months in a row at least to see if there's a difference, right?
Yeah,
Between, yeah,
it's ideal because there's variation from woman to woman, but there's also a
sure.
lot of variation that happens cycle to cycle.
Well, right. I mean, and you don't ovulate out of both ovaries every single month.
Right.
So at least you
Yeah.
have the chance to kind of see what's going on with one ovary versus the other.
Yeah, exactly.
Yeah.
And then if you're doing any intervention, changing your diet, new exercise regime, whatever, you can actually see how that's impacting your hormone levels directly.
So great. So
Yeah.
fascinating. I love it. I love data and I love personalized data. Jessica's also asking about can you help HCG levels go up?
Well, not really, not with OOVA with this,
Mm,
because we're not monitoring that. We can detect it, like I mentioned earlier. If it's
yeah.
there, we'll be able to see it, but that's kind of
Right.
like it's non-specific binding. So I can't tell you that our measurement for the
Right.
BHCG is actually accurate.
Right.
Um, but yeah, I think you'd have to go in for that, the clinical urine test or the clinical blood test.
Yeah, and the reality is, Jessica, the only thing that's going to get HCG to go up if you're pregnant is that the baby keeps growing
Yeah.
and then it's a healthy pregnancy. So, you know, aside from prenatal vitamins, how else can you help, you know, your pregnancy be healthy is you be healthy. And, you know, that's the best possible thing. That is the best possible thing you can do. I don't know anything about Vitex to help regulate a cycle, Stephanie. I don't know. Amy, have you ever heard of that?
I've heard of it, and I do know some of our clinicians recommend it, but I can't
Mhm.
tell you what the like what the reasoning for that is, and then what do you have to present with in order to get that prescribed to you.
Okay. Henny's asking, how do you correct hormonal imbalance? Took contraceptive pills when younger for acne, which did clear her skin. So is this imbalance affecting her fertility too? What should she do? What would you recommend she does next?
There's a lot of things that you can do. So diet, your physical fitness, and your mental stress levels and sleep quality all impact your hormones. So if we can get those things in check, you can directly see how that's impacting your hormones. It's like really small life changes that you can actually implement that will have a drastic impact.
And you'll see. So where do you usually see it in the data?
Well, we share it with the patient by showing them daily action plans, right? So every day you get a customized daily action plan that kind of guides you through these little changes that you can do. We do see it cycle after cycle that you're like, let's say this was really interesting. We had one woman who did not ovulate her first cycle with OOVA. Second cycle, her hormones were just all over the place. Third cycle, she had this beautiful LH and progesterone chart. And I was like, what did you do? And when you look at her metadata, she has said that like, I've modified my diet. I actually started working out more regularly. I got my BMI under control. Like there was a lot of life changes that she implemented in a cycle or in 2 cycles that took effect in the third one.
Oh, wow. Okay. That's amazing. That's amazing. Well, I love that you can almost see instantaneous results, really.
Yeah.
Yeah. So Adaze is following up too. So Adaze is the one that had a pregnancy loss in February, and it hasn't been that long Adaze for, at post miscarriage, if it was just a month ago or so, for your cycles to kind of regulate. And so she mentioned she used to have 26, 27-day cycles, and now it kind of dropped to 20. I don't know that any specialist would tell you that that's abnormal a days, but I would suggest go in for a water sonogram and just get checked out, even call your OBGYN, see if she does water sonograms in office, and, get a full hormone panel just so that you kind of know, okay, when is it safe to even try again? I think these are important things, but it's very normal after a pregnancy loss to not have your cycles return immediately, like clockwork. It's not abnormal. And if you have undergone an HSG, yes, it can help. It can help. And I'm reading a couple of questions that she has. Evening primrose, good for trying to conceive patient. That's probably more a Dr. Raquel question. She was supposed to be live on last Tuesday, so she'll be here not this Tuesday, but the Tuesday after. You can also ask her that question in the app about evening primrose. That's more of our naturopathic fertility specialist question. But certainly if, I think looking at all your questions a days that you need to get in and just get a workup done. And it doesn't have to be, a complete diagnostic, but I think it just sounds like at least to make sure that your cycles return to normal post your pregnancy loss, because again, it hasn't been that long.
You should remember your body's gone through a lot. Like
it's gone through
you
trauma.
have to give it some time to heal.
Exactly. And certainly given that situation, I think you should just want to make sure that you're under the care of a physician as well, so that you can kind of identify if there's anything else going on.
Exactly.
Shara's asking, does thyroid cause prolactin levels to be high? So
it can.
Okay.
I think these questions, there's so many other factors that can play a role in all of this. But yeah, it absolutely can.
Okay. So, which is a great question, because for those of you who don't know, sometimes prolactin levels being high can be a pituitary tumor, and there's other factors too. So people go online and then they freak out, they get scared, and there's lots of different factors that can make prolactin levels high. And one of the recommendations we just heard was also repeating prolactin and not taking sort of the first number as gold, that's the number, but if there is cause for concern, repeating it before jumping to it's a tumor.
Right.
You don't want people to freak out. Okay. I think that's all the questions that we have for today. So, Amy, I just want to say thank you. And everyone, remember, you can go to OOVA.life to get your kit, 15 of these. You'll download the app. You're on both iOS and Android now too, aren't you?
We are on iOS for sure. You can get it from the App Store. If you're on Android, email me and I'll get you into our testing group. We support 65 different phones. If you have one of those, we can get you in.
Okay, fabulous. Love that so much. What is the cost of the kit? And
sure. So the starter kit, which is what you're holding onto, is $199.99. The refill kits, if you do the subscription, they come out to $135.99 per cycle.
Okay, great. Thanks everybody for joining us. Thank you, Amy. You're going to have to thank your son for being on his best behavior and not needing mommy. That was amazing. You're welcome, Shara. Days, if you have follow-up questions or you want to chat live with me, feel free to drop into the DMs. I've never said that before. I don't know why I did now. Drop into my DMs. I've never said that in my life.
You got the lingo down.
I got the lingo. I don't know. So thanks everybody. We'll see you next week. We should be live on Monday, Tuesday, Wednesday, and Thursday of next week. Have a great Easter weekend and we'll catch you next time. Thanks.
Bye. Thanks, Alice.